Good evening. Here we are with our podcast on lower GI bleeding today. So I am Dr. Riya Saha, MD General Medicine, and here we have with us Dr. Krishanu Banik, Gold Medalist Gastroenterologist, and we are about to discuss on lower GI bleeding, and we'll try to spread awareness about the disease and its prognosis and modes of treatment and its complications. So coming to the topic, sir. So what do we mean by lower GI bleeding?
By lower GI bleeding, we generally mean that bleeding per rectum. That means if a patient is having bright red or dark colored blood per rectum in stool, that is generally called lower GI bleeding. That means the bleeding is occurring most probably from colon.
So then how common is it?
Lower GI bleeding is not very uncommon. As per recent data, in Indian scenario, it has a prevalence rate of about 50 patients per 1 lakh population per year. That means I'm not talking about 1 lakh patients. I'm talking about 1 lakh population. So per 1 lakh people, near about 50 persons will have GI bleeding in a certain year, and I think you will not get a family where there is no one ever suffered from a lower GI bleeding.
Okay. So then, who are the people most predisposed or most commonly sufferers from lower GI bleeding?
In our practice, in gastroenterology practice, we see the elderly people suffer most from lower GI bleeding, and the prevalence rises once the age crosses 70 years. And I'd like to know from you, what is your experience and what is the prevalence of lower GI bleeding in your medicine practice?
So in common medicine practice also, we generally see elderly people coming with lower GI bleeding. Sometimes
Okay.
young people come, but they generally have the number is less. More often there are elderly people suffering from lower GI bleeding and over a long duration.
Yes, I just want to add something more, that when younger people have lower GI bleeding, percentage of significant lower GI bleeding is much lower, I think, in younger population, and significant lower GI bleeding occurs most commonly in elderly people.
Yes.
What do you say?
So yes, this is
Right.
often seen in the wards. This is
Right. Okay.
So then, so can you please discuss about what are the common reasons, common causes of lower GI bleeding?
In our country, the most common causes of lower GI bleeding are hemorrhoids, that is, which is known as piles in layman's terminology, and anal fissure, and the other more significant causes are colon cancer or cancer of the lower GI tract, some ulcers in the form from IBD or inflammatory bowel disease, or there may be some rectal ulcers. Some form are called solitary rectal ulcers, and there are some infections also. These are the most common causes of lower GI bleeding, and there are some other causes in certain age group of people, like in elderly people, those who are suffering from cardiovascular diseases, atherosclerotic diseases. That means those who have hypertension, diabetes, and blood lipid levels are high. These people are more prone to develop uh, one thing which is known as angiodysplasia or angioectasia. That means the blood vessels in the inner wall of colon get dilated, and when they rupture due to any cause, these will cause lead to lower GI bleeding. So these are age specific causes. In general, hemorrhoids, internal hemorrhoids or piles, anal fissure, colon cancer, polyps, ulcerative colitis or Crohn's disease, these are IBD, that is inflammatory bowel disease. These are the most common causes of lower GI bleeding.
Sir, in patients who have reasons for lower GI bleeding, what are the common precipitating factors?
Yes, there are certain conditions which can lead to increased rate or increased severity of bleeding. We call these as precipitating factors. Like, suppose some people are taking aspirin, or aspirin is a medicine which is used to treat stroke, or which is used to treat cardiovascular diseases, coronary artery diseases. If some people are getting NSAID, which is painkiller, we all know about painkillers. So these are the common precipitating drugs or factors which increase the rate and frequency of lower GI bleeding.
So then, like we discussed,
Yes.
this makes elderly people more prone
More,
to
yes,
bleeding because
obviously.
they may have angiodysplasia, and often
Yes.
they have these comorbidities for which they're
Right.
taking this medication.
Right.
So then, how do we assess the severity of lower GI bleeding?
Yes, actually, lower GI bleeding uh, present to us in different manners. Suppose the acute severity is sudden severe and a gush of blood coming out of rectum. That is the most severe one. Some people are presenting with some streaks or streaks of blood along with their stool, or stool mixed with blood. These are acute lower GI bleeding, and some people don't have any visible blood. They only have lethargy, exercise intolerance. All these are due to anemia or decrease in hemoglobin concentration. So there is no visible blood. So these are chronic lower GI bleed. In assessing severity, there are certain factors to which we look. One is age. Once the patient is older than 65 years of age, it is taken that they will have more severe bleeding than others. If they have some comorbidities, especially they are having more than two comorbidities means other associated significant health issues like heart disease, kidney disease, liver disease, diabetes, hypertension. So these are comorbidities. So once a patient has more than two comorbidities, then he is supposed to have more severe lower GI bleeding. And if there is any history of blackout, syncope, or there is tachycardia, that is increased pulse rate, if patient's blood pressure is getting low, and if there is any shock, if there is a fall in hemoglobin and requirement of blood transfusion in hospital. So these are the severity assessing factors. Also, when the patient presents and you find lower GI bleeding occurring in front of you, that is also a very significant factor. Suppose somebody is admitted for some other reasons. Suppose he is having pain in abdomen, and now he is having lower GI bleed or blood coming out of rectum, whereas he was admitted due to some other conditions. So these unrelated lower GI bleeding tend to be more severe. So this is how we assess the severity of lower GI bleeding.
Sir, then in case of patients suffering from lower GI bleeding, uh, how what is the rate of mortality? How lethal is it?
In general, lower GI bleeding, if we consider all the causes together, then the mortality is not very high. But in elderly people, especially when they are having acute lower GI bleed, and according to the severity criteria, if they are having severe lower GI bleed, then the mortality rate can reach up to 12 to 15%. And mortality of in-hospital patients are more than mortality of OPD patients. So, taking as a whole, it is not a very fatal cause, but for elderly people and especially those who are hospitalized, lower GI bleeding can be severe and can be life-threatening. And you practice in a hospital, and you manage daily indoor patients. So how often do you find patients losing their lives due to lower GI bleed? What is your experience?
Sir, in my experience, I have seen people succumbing to lower GI bleeding. The number is more than that of upper GI bleeding if I compare between the two major sites of bleeding. And since it's more common in elderly population, they getting in unstable, the rate of them getting unstable is more than it's happening in a younger population. So combined, generally we get people who are all unstable or who have been suffering, or after hospitalization, like you mentioned, they develop. So generally the serious patients are in hospital patients. So I have, in my practice, sir, I have seen the patients, number of patients succumbing is more in case of lower
That's a
GI
very
bleeding.
interesting thing, because the literature says that upper GI bleeding tends to be more severe than lower GI bleeding. But yes, that's a very significant point you have made, that in rural Indian population, when elderly patients get admitted for lower GI bleeding, they tend to be much more sick than patients with upper GI bleed. So yes, it is very, possible that lower GI bleeding taking lives more often than upper GI bleeding, especially in rural Indian
So
population.
yes, maybe they are not very aware and they don't present early, which could have saved them.
Right. Uh, the awareness is the main factor, because it is very difficult to assess how uh, much severe it can be. So, for general population, it is very important to identify the red signs of lower GI bleeding when you should go to your doctor, or when you should take your patient to the hospital. So I think these severity factors in home, we can easily assess if a patient is having blackout, having rapid pulse rate. So I think everybody can see these things. So these are very important parts of assessing the severity of lower GI bleeding at home. So please, I'd like to tell you all that please identify these red flag signs of lower GI bleeding and do not delay hospitalization or a consultation with your doctor.
So then, when a patient comes with lower GI bleeding, how do we move forward in terms of management?
Okay, if a patient is presenting with acute lower GI bleed, we first try to assess the stability of that patient. If he is stable, which is in terms of pulse rate, blood pressure, higher mental function, if he is able to, if he is completely alert, conscious, then the gold standard test, I would say, is a colonoscopy or a sigmoidoscopy. So this is the first and foremost investigation to detect the cause and assess severity and offer treatment to lower GI bleeding patients. But in case if they are presenting in a decompensated state, suppose the patient is having a systolic blood pressure. Systolic blood pressure means we express blood pressure in terms of x by y, like 110 by 70. So the upper one, if it is below 100, so it is decreased blood pressure. If the consciousness is depressed, patient is not completely alert, and there are comorbidities due to which we cannot take the patient to a colonoscopy room. In that case, the most important investigation is uh, CT abdomen, and along with CT angiography. It can localize the site of bleeding and assess severity of bleeding, so that we can move forward with uh, other modalities of diagnosis or treatment. And patients who are presenting with chronic lower GI bleeding, uh, investigation in these patients are varied. We generally do a pan endoscopy. That means both upper GI endoscopy and lower GI endoscopy or colonoscopy. After both upper GI and lower GI endoscopy, we can diagnose almost 70 to 80% cases of lower GI bleeding. If it is not diagnosed or there is no source of bleeding, then we move forward with second line tests. These are capsule endoscopy or other imaging. So these are the approach to diagnose lower GI bleeding. So I think uh, in today's date, we should be well aware of what the diagnostic modalities for lower GI bleeding are. These are colonoscopy with or without upper GI endoscopy, CT abdomen and CT angiography, sigmoidoscopy, and wireless capsule endoscopy. These are the first frontline investigations for lower GI bleeding.
Okay. So can you please elaborate a bit on colonoscopy or sigmoidoscopy as means of diagnosis?
Yes. Sigmoidoscopy means the lowermost part of the colon. We try to visualize or examine the lowermost part of colon, that is rectum and sigmoid colon. These are near about 30 to 40 centimeter from the anal aperture. So this is called sigmoidoscopy. When we don't have much time for bowel preparation, for colonoscopy we need a good bowel preparation. That means uh, we should make the bowel clean of the stool and food debris to make it properly visible. So when there is no much time, we proceed with a sigmoidoscopy. This is the lowermost part of colon. And in colonoscopy, uh, we try to examine the whole colon up to cecum, and in some cases, the terminal portion or lowermost portion of our small bowel, that is ileum. So this is the difference, basic difference between sigmoidoscopy and colonoscopy in terms of length of colon we examine. There is no basic difference, no procedural difference, but they are different in terms of up to which we can examine.
Based on the area explored.
Yes, exactly. Based on the area we try to examine.
So is there any role of surgery here?
Surgery has a very low role in lower GI bleeding, and in today's date, uh, very less number of patients with lower GI bleeding do not get a diagnosis with such varied and such broad array of investigations. So I don't think surgery has a very major role in lower GI bleeding. And which is what is your experience? Means what about surgery? Do you take regular surgery consultation for
So
lower
no,
GI bleeding?
for lower GI bleeding, like when you mentioned about the causes, sir, when we suspect that the cause may be piles, in those cases sometimes surgery consultation is taken, but generally for all the medical causes there is little to no role of surgery here.
Right,
And
exactly.
on the hindsight, we often get referral from surgery department for further
Yes, that is
evaluation
true.
of lower GI
We also
bleeding.
used to get referrals from surgery for lower GI bleeding. So
Yes.
surgery has a very minimal role.
Yes, sir. Sir, you mentioned while you mentioned about the causes of lower J bleeding, you mentioned about tumors or cancer causing lower J bleeding. So, sir, how to detect or how to move forward about diagnosing whether a cancer or a tumor is causing the rectal bleeding?
Without a colonoscopy, there is no much option to detect if it's a tumor or polyp or differentiation between these two. And I think you remember we had a podcast about colonoscopy, about which patients or when asymptomatic patients should undergo a colonoscopic examination. So, in that series, we discussed in detail that obviously those who are presenting with lower GI bleeding or rectal bleeding, we have to do a colonoscopy if possible. It is the best way to detect the cause of lower GI bleeding, whether it's a polyp or whether it's a large growth, mass tumor, or it's an ulcer. But in asymptomatic patients also, those patients, those who are not having any kind of GI symptoms, in our population it is suggested that people should get colonoscopy once he is older than 50 to 55 years. So colonoscopy is the modality of choice for diagnosing the cause of lower GI bleeding, be it malignancy, be it cancer, be it polyp, or whatever.
Sir, then what do you suggest for population in general when to go for screening?
Yes, that is the big question, and we as a nation, India is on the verge of, I mean, uh, it should adopt a screening program for lower GI cancers, because GI cancers are increasing. So in Western world, when where there the population is small, uh, most of them have a screening protocol when they start lower GI screening by colonoscopy after the age of 50 to 55 years. But keeping the operational feasibility and affordability in mind, in India it is very difficult to generalize colonoscopic, offer colonoscopic examination to the general people of 140 crores of people. But yes, according to the current standard, one should get a colonoscopic evaluation once he is 50 to 55 years of age, if possible.
Okay, sir. Sir, now will you please like to discuss about radiation proctitis?
Yes, you have mentioned a very important cause of lower GI bleeding. Radiation proctitis is a condition when a patient gets radiation therapy in his or her pelvic region, that means lower abdomen and around genital region, for some other reasons like cervical cancer or bladder cancer or prostate cancer. So when radiation is the cause of lower GI bleeding, uh, and there is ulcer of the mucosa of rectum, this is called radiation proctitis, and it can occur both acutely as well as a chronic effect of radiation. After radiation, when the dose of radiation is more than 4000 centigrade, almost 75% or more of the patients will have lower GI bleeding, both acutely, and most of them will have some chronic effects. Acute effect due to sloughing of mucosa, and chronic effect is due to ischemia of the blood vessels, those which are supplying the wall, innermost wall, that is mucosa and submucosa of rectum. So these blood vessels get obliterated by clots or thrombosis, and they will lead to reduced blood flow to the mucosa, and ultimately it will cause ulcer and lower GI bleeding or bleeding per rectum. So this is radiation proctitis. It is not very easy to treat radiation proctitis. It is for us also a difficult condition to treat. So we should make people aware of the bad effects of radiation, so that they can take into consideration of other treatment options as well, because radiation proctitis is a difficult condition to treat.
Okay, sir. So then, apart from radiation proctitis, can you please discuss about treating other causes of lower GI bleeding like piles or hemorrhoids?
Yes, hemorrhoids is a very common condition. As a cause of lower GI bleeding, we often get hemorrhoids. Generally, these are very benign conditions, and initially we treat it with different medications. Like, we suggest people to take high fiber diet, and we prescribe some stool softeners. Once medications fail, then we try to offer some endoscopic therapies in the form of band ligation. The enlarged veins are ligated with some rubber bands through endoscopic means, or we can inject some sclerosant to the area surrounding that veins. So these are the medical and endoscopic therapy. And in minority of patients, when it is not controlled by these two means, then offer surgery, which may, dissect and ligate those blood vessels to treat hemorrhoids.
Okay, sir. Sir, and will you please discuss about treatment of some other causes briefly?
One thing I would like to mention, that IBD as a cause of lower GI bleeding is increasing in Indian population. There are uh, there are much debate about the rate of rise of IBD in Indian population once it was thought to be a disease of Western population. But nowadays in gastroenterology practice, we often get IBD patients in the form of ulcerative colitis or Crohn's disease. So both these conditions are well manageable with drugs or medicines. Sometimes you must have also prescribed some 5-amino salicylic acid group of drugs. We use steroids, and we use some disease modifying drugs like azathioprine, methotrexate, and nowadays we offer them biologicals. These are antibody kind of things which have better efficacy and better side effect profile. So mainly the treatment is medical. Also, there are some role of diet modification, especially in children when a child is suffering from severe IBD. Then some elemental diets may have role, and in some cases, of course, we offer them surgery. What is your experience about IBD?
So, from the cases that we get, from the IBD cases that we get in medicine practice, most of them, sir, they can be managed, or they can be kept at maintenance with conservative management,
Yes.
with drugs mainly.
Yes.
Uh, Sir, now can you please summarize everything in short for the audience?
Okay. Lower GI bleeding is a significant cause of morbidity and mortality, and in elderly population, the rate of lower GI bleeding is more, as well as the severity is higher. We should understand and try to point out the red flag signs or the danger signs of lower GI bleeding in terms of tachycardia or increased pulse rate, syncope, or blackout when uh, the patient is suffering from other coexisting diseases. These are the risk factors for severe lower GI bleeding, and we should not delay admission or a consultation for rectal bleeding in those cases, especially in elderly population. And for asymptomatic patients, we should offer, if possible, a screening colonoscopic examination to persons aged above 50 to 55 years. And with this awareness, we can easily prevent death from lower GI bleeding. It is very much amenable to treatment, and in today's date, there are definitive management to almost every cause of lower GI bleeding.
Okay. Thank you for such a lucid discussion. We got to know about the causes and the way to move forward in case of a lower GI bleeding. So I hope patients will try to detect their symptoms at home and present to a doctor and not delay the diagnosis.
Yes, of course. And as a physician, I think physicians are uh, very much, I mean, they have the knowledge and capacity of managing lower GI bleed with medicines before sending them to gastroenterologist. And also people should report to their physician without any delay for lower GI bleeding. That is the cornerstone of managing lower GI bleeding successfully.
Thank you, sir.